Hello, this is the recording for my on-campus dissemination. Let me share my screen. Give me one sec. Okay. Okay, here we go. All right. Imagine being in a classroom where the lights feel painfully bright, the sounds feel overwhelming, and even sitting still in your chair feels nearly impossible. For many children with sensory processing challenges, everyday environments can feel exactly like this. Sensory-enriched spaces and structured programming can provide children with the support they need to regulate their bodies better and participate in meaningful daily activities. Good evening, everyone, and thank you for being here today. My name is Bridget Joes, and I'm excited to share my doctoral capstone project titled Sensory Explorers at the Sensory Zone. During this presentation, I will discuss the development, implementation, and outcomes of the Sensory Explorers program, as well as the parent, education, and staff training components designed to support children, families, and staff. I hope that this presentation provides meaningful insight into the importance of sensory-informed programming in supporting children's occupational participation. My professional journey began with a bachelor's degree in exercise science from UW-Parkside, followed by work as an ACE certified personal trainer in Madison, where I trained children, adolescents, and collegiate athletes. Through these experiences, I developed a strong interest in supporting children's development and began to recognize the critical role of sensory processing and participation in performance. I went to earn my occupational therapy assistant degree from Madison College and now completing my doctoral degree at Concordia University. Across my education and clinical experiences, I have worked with children with diverse needs and further developed my understanding of sensory integration. Over time, I became increasingly aware of the lack of accessible, inclusive, and sensory-friendly spaces in our community. But I believe all children, regardless of diagnosis, deserve a space where they can thrive, grow, and play. This led me to establish a long-term goal of creating a sensory-focused space in the Madison area that supports children's participation, while also providing education and resources for families. This capstone project represents the first step toward that vision, integrating my background, clinical experience, and passion to create a meaningful, sustainable program at the sensory zone and the greater Madison community. This presentation will guide you through each component of my capstone project. First, I'll review the needs assessment, highlighting the sensory zone's mission, services, and the specific needs that shape this project. Next, I'll share findings from the literature review, which support the relevance and importance of sensory-based programming in pediatric practice. We'll then explore the project implementation, including the development of 3 key components, followed by an evaluation of outcomes and the impact on children, families, and staff. Finally, I'll conclude with key takeaways and personal reflections on the significance of this experience. The site, the sensory zone. The site of my capstone project is the sensory zone, located on the east side of Madison. Its primary focus is to provide an inclusive space where all children can grow and thrive without judgment. The main goal is to offer a safe, welcoming environment where children can explore their senses, make connections, and grow in ways that work best for them. Finally, the sensory zone fosters a community, helping children and families build relationships and connect with others for ongoing support. There are many different services the sensory zone offers, including engaging children's senses and fostering learning through play. The facility includes a sensory gym and exploration rooms, such as a calming room, interactive touch wall, imagination town, game room, and more. Families can access respite care, day camps, after-school programming, and birthday experiences. Sensory labs provide hands-on opportunities for children to explore different senses through creative play. Additionally, the sensory zone offers a sensory shop to purchase fidgets and sensory tools for at-home exploration, allowing children and families to continue sensory learning outside the gym. The sensory zone has worked with many different kinds of children. Common diagnoses include autism, ADHD, sensory processing disorder, executive functioning, anxiety, and disruptive mood disorder. As well as a variety of ages, a mix of boys and girls, typical and atypical, and majority are Caucasian, Asian, Hispanic, and African American. To understand the current needs of the sensory zone, I conducted initial discussions with my capstone site mentor, Courtney, in January 2025, followed by a follow-up conversation in February 2026. Some key needs identified included expansion of programming. Current offerings primarily serve younger children. There's still a desire to develop programs for adolescents, tweens, and young adults. Staff development, with 14 new staff recently hired, training in therapeutic principles and strategies to enhance occupational engagement through play and sensory-based experiences is a priority. Family education and resources, enhancing monthly sensory labs and online resources to better support families at home, and facility improvements, including updates to sensory spaces, outdoor areas, and maximizing their engagement and accessibility. After synthesizing discussions and a SWOT analysis, it became clear that the sensory zone is well positioned for growth and innovation, but faces key challenges. Priorities such as expanding programming, strengthening staff and family education, enhancing sensory spaces, and fostering an inclusive community guided the development of my doctoral capstone project and informed its goals, implementation, and evaluation. I conducted a comprehensive literature review. Concepts related to sensory integration, processing, multisensory experiences, multisensory environments, impact of sensory deficits on children's occupational participation, quality of life, and development were searched. 5 databases were used, 19 articles met the inclusion criteria, and each article was assessed using Sackett's level of evidence. The majority of participants were children ranging in 7 months to 21 years, various needs and abilities. Some diagnoses included autism, sensory processing, cerebral palsy, ADHD, intellectual, and developmental disabilities. Participants were representative of the sensory zone population. Some outcome measures included the GAS, or the Goal Attainment Scale, which was an outcome measure I used in my study, the sensory profile, and the Vinland Adaptive Behavior Scales. 5 common themes were found in my literature review. The first one, importance of understanding sensory. Sensory integration therapy, SIT, is commonly used in pediatric practice. Aries sensory integration, ASI, is a structured, play-based, evidence-based intervention designed to improve sensory integration and functional participation in children with ASD, sensory processing disorder, and other diagnoses. While both ASI and sensory-based intervention, or SBIs, can be individualized, ASI is distinguished by its theoretical foundation, active child care engagement, and adherence to fidelity measures, whereas sensory-based interventions are typically adult-directed and often focus on short-term regulation than long-term functional outcomes. Theme 2, the impact of play on children's development. Play is critical to development, autonomy, and quality of life. Children with disabilities may play differently, and ASI supports their cognitive, motor, behavioral, and emotional growth. Theme 3, the use of sensory integration interventions to improve occupational participation and quality of life. ASI improves daily activities, social skills, adaptive behaviors, and sensory processing. Non-individualized sensory-based interventions show limited effects, though multisensory approaches can boost function and focus. Theme 4, effectiveness of multisensory environments. Sensory rooms offer controlled stimulation across senses, supporting touch, taste, smell, and sensory-seeking behaviors. Layout, equipment, lighting, and all matters. Theme 5, program development of sensory integration therapy, SIT, and ASI. One-on-one 40-minute sessions yield the best outcomes in social skills, adaptive behavior, and sensory processing. Future research is needed to standardize SIT protocols and optimize therapy progression. So now I'm going to share my goals and outcomes. So outcome number 1 was to develop and expand programming. Goal 1 was to create Sensory Explorers program, which was a 5-week multi-sensory play experience for pediatric clients and families. Goal 2 was to develop educational materials for staff to support sustainability. And goal 3 was deliver an educational workshop to staff. Outcome 2 was to improve children's occupational participation. Goal 1 was to develop 5 weeks of family-centered educational materials with sensory-based activities addressing all 8 sensory systems. Goal 2 was to trial educational materials with children and families. Project implementation. My capstone project at the Sensory Zone focused on 3 core components, including the Sensory Explorers program, family education, and staff education. IRB approval was obtained from Concordia University on September 15th, 2026. The model that was used was the person, environment, occupation, performance model. Guided this project with a focus on improving occupational participation through the dynamic interaction between children, their environments, and their meaningful activities. This model was selected because it emphasizes how these factors work together to influence occupational participation. Participants. Families were recruited through multiple avenues. Families were initially recruited through an email survey targeting children 5 to 8 years old, with eligible participants contacted directly. Additional participants were recruited through staff referrals, on-site camp participation, and flyers such as the one shown. In total, 4 children ages 5 to 7 were enrolled, with parent or guardian involvement required. All participating families completed consent and assent procedures prior to starting the program and receiving education. All staff members at the Sensory Zone participated in the required Sensory Explorers training and workshop. For the Sensory Explorers program, there were 3 components: research, design, and feedback. For the research, it was grounded in evidence-based practice and ASI principles, drawing from literature review, faculty membership, and family input. I collaborated with my on-site mentor to evaluate existing programming and identified strength gaps and long-term goals. Family surveys informed priorities, scheduling, and desired sensory experiences. For the design, I developed a 5-week face-to-face group-based sensory program addressing all 8 senses, including movement, play, and regulation activities. Each session included child-focused sensory exploration and a brief parent education segment to reinforce skills at home. For feedback, program draft was reviewed by my faculty mentor and my on-site mentor to ensure developmental appropriateness, curriculum structure, activity selection, and alignment with children's needs, and then materials were then finalized. Ongoing reflection and weekly adjustments were made during the implementation based on child engagement, staff observations, and family input. This ongoing process ensured the program remained adaptable, client-centered, and supportive of occupational participation. So I developed a variety of materials for the Sensory Explorers program, several of which are highlighted here, including activities to design, support children's sensory exploration. You can see like smell, you can see taste, you can see some different calming strategies, as well as like the senses and emotions. Family education. For the research, again, this was grounded in ASI principles, just like the Sensory Explorers program, and it was informed by my literature review, faculty mentorship, and family input. It focused on increasing families' understanding of the 8 senses, patterns of sensory responsiveness, and strategies to support children participation at school, home, and in the community. Family priorities and practical needs guided content development to ensure relevance and carryover of the program. Design created 5 weeks of interactive PowerPoint educational materials aligned with the weekly Sensory Explorers themes, delivered via PowerPoint presentations at the end of each session with supplemental handouts and home activities to reinforce learning, and the content emphasized practical strategies, sensory activities, and explanations were clear and family-friendly language. Materials were then reviewed by on-site and faculty mentors for alignment of appropriateness and usability for families, ongoing reflection, and post-program outcome measures such as the goal attainment scale and surveys assessed whether the education supported children's occupational participation, and refinements were made in feedback to help keep the materials practical and responsive to children and family needs. This image was used to introduce families to the educational PowerPoint presentations and support initial engagement. Lastly, staff education. For the research, it was designed to promote the sustainability of the Sensory Explorers program, informed by adult learning theory and evidence-based teaching strategies, focused on preparing staff to understand sensory integration, the 8 senses, and hypo versus hyper responsibility. The literature review and mentorship guided strategies for engagement, practical application, and professional development. For the design, It was developed as an interactive workshop with a PowerPoint presentation, educational handout, and hands-on activities aligned with program objectives. The workshop included discussion, role play, and team activities to support understanding and application of sensory-based strategies. Materials provided staff with practical tips to support children's occupational participation and promote program sustainability. For the feedback, Mentor and my faculty reviewed to make sure the materials were inclusive and adaptable for staff learning needs. Refinements were made based on feedback to enhance engagement, understanding, and practical application of strategies. Staff were invited to complete surveys and assessments such as the Program Sustainability Assessment Tool, or PSAT, to inform future improvements and support ongoing program sustainability. This is an example slide from the staff educational PowerPoint on your left, along with one of the educational handouts provided to support staff training and implementation. I provided them some tips and tricks for programming. Project evaluation and results. A mixed method design was used to collect both quantitative and qualitative data. For quantitative data, we used the goal attainment scale, which measured individualized changes in occupational participation, specifically in ADLs and social participation, with a focus on self-regulation and interoception. This was collected during the first session during week 6 and the last at week 11. The program sustainability assessment tool was used during the staff training to evaluate perceived sustainability and long-term integration of the program. Qualitative data included surveys and structured observations of children's families and staff to capture participant experiences, perceptions, and feedback. Together, these methods provided a comprehensive evaluation of the program impact, feasibility, and occupational participation across homeschool and community contexts. Ethical considerations include informed consent and assent, volunteer participation, confidentiality, secure data storage, and approval of all tools by faculty and site mentors. And now we'll move on to the results. The Sensory Explorers program first. Next, the results of the Sensory Explorers program are presented. Outcomes were evaluated using multiple data sources, including the goal attainment scale on your left, structured observations on your right, and child report self-surveys. These outcomes provide a comprehensive view of changes in skill performance, participation, and participant experience across the duration of the program. The GAS, pre- and post-intervention GAS scores were collected for all participants. An Excel-based GAS scoring system was used to standardize and quantify change. All children demonstrated improvements in GAS scores from baseline to post-intervention. Mean scores increased from 10 to 20 points, and all participants achieved their GAS goals within the 5-week program. Participants met their GAS goals during approximately 67 to 75% of group sessions, indicating consistent goal attainment across most sessions. Observations. For weekly observations, they were conducted from weeks 2 to weeks 5 across 9 skill domains. Change scores were calculated by comparing week 2 and week 5. Ratings to examine differences in skill performance over time are shown in this figure. All participants demonstrated overall improvements in skill performance across multiple domains. The greatest was in Child C, as you can see, followed by Child D, B, and A. Figure 3 displays the percentage of participants who showed improvement across specific skills. And the most notable skill gains included identifying body signal and emotions, which is shown by the arrow, following directions, self-regulation, and peer interaction. Additional improvements were observed in sensory engagement, attention, task participation, and safety awareness. Minimal change was observed in motor planning, and no change was observed in communication and needs and preferences. The child survey. 4 children completed post-program surveys, with 75% reporting they enjoyed the program and felt happy about participating. All children enjoyed at least some activities, with favorites including the Easter egg hunt, musical dots, dance party, and time with peers. Participants also reported several benefits, as shown in figure 4 here, including feeling calmer, improved attention, following directions, and peer interaction and task completion. One child noted improved school performance. Additionally, most participants 3 out of 4 did not want the program to end, including a positive overall experience. 4 families completed post-program surveys with consistent positive feedback. All reported high satisfaction and felt the program was welcoming, inclusive, and supportive. Families observed meaningful improvements in their children, as shown in Figure 5, especially with emotional regulation, along with gains in social participation, independence in daily activities. Many also noted children independently using sensory strategies across settings. All families found the educational materials helpful and felt more confident supporting their child's sensory needs. Overall, families reported positive outcome and interest in extending the program. The PSAT, the results were calculated from staff following the educational workshop, and scores were calculated across 8 domains to determine overall program sustainability. As shown in Figure 1, scores range from 4 to 7, with staff number 1 and 2 providing the highest overall rating as 7. The highest rated domains were founding stability, strategic planning and partnerships, and program evaluation were rated lowest. Environment support, organizational capacity, communication, and program adaptation fell in mid-range. Overall, these findings support moderate to strong sustainability potential, with opportunities for growth in lower-rated domains of partnerships and program evaluation. Lastly, in addition to the PSAT, staff members completed the post-workshop survey. Overall, 100% reported that the training increased their understanding of sensory integration and improved their confidence in supporting Sensory Explorers program. All staff also found the materials clear, and most agreed that the training provided practical strategies they could apply in their roles. Key learning including the concept of the 8 senses, particularly vestibular, proprioception, and interoception, as well as strategies to support self-regulation and identifying sensory needs. Staff also reported applying these strategies with teaching emotions, using body scans and visuals, and supported regulation in daily practice. Most staff did not anticipate barriers to sustainability, though a few noted potential challenges with consistency and child engagement. Overall, staff reported high satisfaction with the training and would recommend it to others. The purpose of this capstone project was to implement a sensory-based program at the sensory zone and evaluate its impact on children's occupational participation, as well as the role of family and staff education in supporting sustainability. The findings support the effectiveness of the Sensory Explorers program and its educational components. Collectively, the results suggest the Sensory Explorers program and accompanying educational materials were effective not only in enhancing children's occupational participation, but also promoting family well-being, quality of life, and daily functioning, consistent with ASI research. This capstone project was designed to create a holistic impact across children, families, and staff in the site through structured evidence-based programming to support sustainability for program development and service delivery. Findings from the Sensory Explorers program and family educational materials show positive outcomes in children's sensory processing and family understanding of sensory strategies, along with strong participant feedback. Findings from this are consistent with current literature supporting sensory-based interventions guided by ASI principles, demonstrating measurable improvements in children's occupational participation across individualized goal-directed outcomes. The use of GAS and incorporation of both quantitative and qualitative data mirrors established research methods, furthering support the ASI-based interventions in improving self-regulation, social participation, and daily functioning. Staff education results include PSAT and post-workshop surveys, increased in knowledge, confidence, and consistency, in implementing sensory-based strategies, supporting program sustainability and expansion. Overall, this project provided structured programming, educational resources, and data-driven insights that can be used to guide future program development and better meet the sensory and occupational needs of children and families at the sensory zone. The conclusion: this project provides a comprehensive overview of an initiative designed to enhance children's occupational participation at the sensory zone through Sensory Explorers program, along with parent and staff education. This project addressed gaps in sensory programming by integrating evidence-based interventions and training to support children, family, and staff. Findings and supporting literature demonstrate the sensory integration within enriched environments can improve children's occupational participation in meaningful occupations. Program outcomes were confirmed overall and effective in meeting intended goals. And ultimately, this project contributes to sustainability, inclusive, and evidence-based programming and education at the sensory zone, with a meaningful impact in children's functioning, quality of life, and long-term well-being. The greatest reward of this project is knowing that the children, families, and staff who participated have the tools and support to grow, thrive, and reach their full potential as independently as possible. Thank you for attending this evening, for your time and your attention, and I appreciate you being here, and I hope you are having a great rest of your evening. I welcome any questions you have. And thank you.